It is time now for our weekly segment with Dr. David Agus. He is ready to answer all of your questions about COVID-19, and he's joining us now. So, Dr. Agus, it's good to see you. Let us begin with this very first question. It comes from a family of a 2-year-old who just recovered from COVID. They are anticipating the approval of a vaccine for kids under 5 and want to know how long to wait before getting the child's first dose.
So the real answer is we don't have a lot of data to give an answer in this situation, but I would say that Tuesday, we think the vaccines will be out for under the age of 5. And I would probably wait 6 weeks from resolution of symptoms from the COVID infection to start the vaccination process. 3 with Pfizer, 2 with Moderna.
Okay, so we have another parent question. This one is actually about an 18-year-old who no longer has symptoms, but keeps testing positive. They want to know if they can bring this 18-year-old to a family wedding this weekend.
That's always a difficult one. And what happens is after you clear the virus, many times there are fragments left and the test can be positive even though you're not infectious, although some people can be infectious for a long time. So what we normally say is 2 days after full resolution of symptoms, at that point, you should not be infectious. When you're going to a family situation where there may be elderly there, it certainly makes sense if you ask that person who is testing positive, even though days out, to wear a mask. There's not a lot of downside to doing that.
Doctor, does it matter if it's an antigen test or a PCR test?
Yeah, they're both going to be sensitive. Probably the PCR test more sensitive. So it's more likely you'll be positive on a PCR test days out than you will on an antigen test.
This next person is curious if GI or stomach issues are common after having COVID. And I'll just tack one on. My question is that also a symptom of COVID?
Yeah, so there's no question that we have what we call ACE2 receptors, which are where COVID gets in the GI tract. And GI symptoms happen in certain people and some people, and it can be pretty significant and they can last. And so I've seen patients over the last months that have had 4, 5, 6 months of GI changes after having COVID, and then it's slowly resolving. So it's certainly real.
The next question is about a Canadian study which looked into whether people with type O blood are at a lower risk for the infection. Is there anything to that?
Well, at first I thought you said a comedian study, and I was very excited about what a comedian's going to say about this. The Canadian study. So, if you look at type O, type A blood, there was a lot of hullabaloo early on in COVID. Well, some are protected and some are not. And the bottom line is there's no real significant difference at all. We're all just as susceptible to COVID and just as likely to get potential side effects from getting COVID.
All right. Here's another parent wondering about boosters. Their 11-year-old was vaccinated in November. They want to know if they should wait until the fall to get the child a booster.
I get this question a lot. And my bottom line is, if you're 5, 6 months out from your last shot, get the booster if you can. Be protected now. You just don't want the complications of potentially long COVID, et cetera. We will, in probably mid to late fall, get boosters that are much broader, that will have some Omicron in them and different variants mixed together. And at that point, probably again, 5, 6 months from now, we'll get another booster to give us broader immunity. But get it now, get protected for the summer.
What about boosters for those under 50, is it? When can we expect that to happen?
So I think what you're talking about is a second booster for people under the age of 50. And I think we're going to see data and announcements on that in the next few weeks. All the attention now is under the age of 5, and rightfully so. Every man and woman hour at the FDA, the CDC is focused on that because this is the last population that needs a vaccine. And coming this Tuesday, they're going to get it, assuming the CDC does what we think we will this weekend.
All right, Dr. David Agus, thank you so much.
Thank you, guys.
So if you have questions about COVID-19, send them to Dr. Agus. You can tweet him at David Agus, or you can text him at 310-299-9322. We are going to have Dr. Agus on every Thursday morning, and he might answer a question of yours right here on the stream.